Hi, I'm David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain relievers throughout the state, including pain clinics, chiropractors, and physical therapy practices. The topic today is neck pain after neck surgery. You had a successful neck surgery, such as a one-level neck fusion or what have you, and things are going along fine, and then 6 months, 2 years, however long, you start to have neck pain again, or arm pain. It may be the same arm pain or it may be new arm pain. There are 3 main reasons that neck surgery that was initially successful fails later on. Number 1 is hardware failure. So the reason that surgeons put in the screws and rods during a neck surgery is to keep the bone stable, so that the bone between the fake bone that's put in will help fuse and weld the 2 bones together, okay? And that's either called an allograft, or maybe they took bone from your own hip and put it in there. But what you want those 2 bones to fuse together. Well, what if they don't? Then the screws and rods that are holding the 2 bones together, they can loosen over time. They get fatigued. So the screws can start to loosen, they start to toggle, and they can break. They can just snap. When that happens, the movement that is seen between those 2 levels that was supposed to fuse together can get increased, and your pain can go right up with it. So that's number 1, all right? Your body didn't fuse, the hardware broke or loosened, and the pain shot up. Okay, so the second reason that you can have increased pain after a neck surgery that was initially successful is that when you fuse 2 levels together, say C5 to C6, you can't absorb any stresses at that level anymore. The stresses that normally you get absorbed, when we bend and twist our neck, it's going to either go up from C5-6 or down. Okay? So those adjacent levels might get degeneration, and that's called adjacent segment degeneration. That can be a big problem. It can start to develop pain in the neck, the shoulders, the arms, if it's pinching nerves because of the accelerated arthritis and degeneration. Well, what can you do about it? Studies show that the incidence is 3% per year. So every year you have a 3% more chance of having accelerated adjacent segment degeneration that is symptomatic. A lot of times it can be treated without surgery by pain management doctors. They can do medications, they can do different types of medications, not just opiates. They can also do epidural steroid injections, facet blocks, F-A-C-E-T, medial branch blocks, or radio frequency ablation. All of those, there's information on the website at floridapainnetwork.com. But these are all things that can be done by pain management doctors, a lot of which are in our network. Okay? So there are options to try and avoid surgery. The third reason that people can have increased neck pain after initially successful surgery is scar tissue. If you had a nerve root that was being pinched, and that was the reason you had your surgery, to take the scar tissue away, and in the same surgery fuse the 2 bones together, what can happen is scar tissue can come back and envelop the area where the pinching was to begin with and freed up. So you had a disc herniation, it pinched a nerve, it got taken away, scar tissue comes back and fills that area, and it can envelop the nerve. And in the low back, that's called post-lumbar laminectomy syndrome. Long fancy name. Basically it just means, hello scar tissue, I'm here to take over your nerve root. So going back in and doing another surgery to take the scar tissue off often might be successful, but it can result in more scar tissue coming right back. So you can get into a vicious cycle, and you can also damage the precious nerve root that has been through multiple surgeries. Sometimes the best option is not more surgery, but it can be some of the pain management options, including what I just mentioned. But as a last resort, a spinal cord stimulator can be very helpful to take away that recalcitrant or new pain, that's just making it very difficult to function, to live, concentrate, play with your kids. Okay? So those are 3 reasons that initial neck surgery may fail. Now, the pain clinics in the Florida Pain Network, some take insurance, some don't. Some do interventional treatments, some don't. So check out our website at floridapainnetwork.com. And if you need a pain management doctor, just click that. I need a pain management doctor. It'll show you the ones that are closest to you, information about the clinic, the phone number to call. And you can find out if they take your insurance. A lot of times it says it right there, and so on and so forth. There you have it. I'm David Greene, CEO of the Florida Pain Network. Your pain stops here.